effective from 1 p.m. today. The full lockdown for 48 hours. That means the local government areas of the City of Darwin, the City of Palmerston and Litchfield.
4 new cases in the NT, the first community transmission the Territory has seen since the pandemic began.
We need to use the next few days to pause everything, to buy us more time while we continue to test, trace and trap this virus.
The suspected Delta outbreak was triggered by a fly-in, fly-out worker believed to have contracted the virus in hotel quarantine in Brisbane before flying on to a gold mine northwest of Alice Springs. 750 workers are now isolating at the mine. 900 more have dispersed, travelling to places including Brisbane, Perth, Alice Springs and Darwin.
We are asking all 900 to identify where they are isolating. Where they have travelled to another jurisdiction, we will advise that jurisdiction.
It comes as New South Wales added 30 new cases overnight, growing its outbreak to 112.
11 of those were already in isolation, which is positive. The balance of those cases are all linked, which is another positive.
The Premier defending her decision to delay a full lockdown as the New South Wales outbreak spilled over to WA, where a woman who returned from a trip to Sydney tested positive overnight. Authorities stopping just short of a lockdown.
The Perth-Peel region will move to Phase 1 restrictions from 12 noon today. Mandatory mask wearing indoors, on public transport, public events that cannot be restricted to 150 people will be cancelled or played without spectators. Travel to remote Aboriginal communities will be restricted.
The Federal Health Minister fending off suggestions the country is on the brink of an outbreak as the vaccine rollout crawls along.
I am confident that we'll get through it. There will be cases that will follow. We need to be honest and aware of that. But can we manage it? Yes. Will we manage it? Yes.
Well, to give us his thoughts, we're catching up with the host of ABC's Coronacast, Dr Norman Swan. Norman, the New South Wales Premier Gladys Berejiklian says that this is the scariest moment of the pandemic so far. Do you agree?
I think there have been lots of scary moments, but this is a pretty scary moment with a virus where one person in an uncontrolled situation can probably pass it on to 6 or 8 others. So this is a very contagious virus. And as more older people are vaccinated, it's going to affect younger people disproportionately because they are mostly vulnerable to this.
Norman, winter was always anticipated to be the danger time, and that's certainly come true in New South Wales. Do you feel like there's been a part to play for that complacency, that we're the envy of the world? We've heard it so many times, that we didn't plan for winter properly.
It's not clear how you could have planned for winter other than getting people vaccinated, and we failed miserably at that so far. That was really the only plan for winter. But most states went back to normal. When you go back to normal, these viruses, just even the old virus, the one that started in Wuhan, they just go rampant when you go back to normal. Once the virus goes into the community, it spreads fast, and you only need one little weak spot. And our major weak spot is hotel quarantine. Look what's happened. Northern Territory locked down, effectively, Darwin locked down because of a hotel quarantine leak. And it's not the first in Queensland. They've had a few. The flight crew, you've had spread from room to room. And yet we are not building purpose-built facilities for another 6 months. Why we can't just throw up a facility very, very quickly? We badly need it now because this is our weak spot, winter or summer.
Norman, you're referring to the vaccine rollout there, and we all know the issues around that. But the government's been justifying the pace of the rollout, in part by saying that we were getting frontline workers and the vulnerable vaccinated first. That's why everyone else had to wait. We couldn't open it up more broadly. But it turns out that frontline workers like limo drivers, air crew, for example, haven't been vaccinated anyway. A lot of the aged care workers haven't been vaccinated. Who is getting vaccinated then, and why are the rest of us waiting?
Well, a lot of people aren't waiting. New South Wales actually has been quite interesting, is that Pfizer's been quite reasonably available until the 50 to 59 issue arose to a lot of people. But the supply, that's the problem, Hamish. And there just is not enough supply of Pfizer, which is the one we're relying on now for the under 60s. And there's just not enough around. And they have really stuffed up, particularly aged care. There's one myth about aged care, by the way, and it's important that people in New South Wales will appreciate this, is that The myth is that visitors bring in COVID-19. It's staff who bring in COVID-19. We saw that in Melbourne with the Arcare complex in Maidstone. It's staff, and the Commonwealth has failed to immunise staff. You can't get data on it, and you had the bizarre situation of contractors going into aged care and not immunising staff while they were there. And there's churn, and they changed the regulations late last year to allow staff to work in more than one facility. And it's only when you've got an emergency on that they clamp down on that. Lots of problems.
Dr. Swan, how damaging was this idea that getting vaccinated is, in Scott Morrison's words, not a race?
Very damaging, because I suspect that not a race goes back to their procurement policy. And they obviously thought that 10 million Pfizer doses was part of a 4-vaccine strategy. A 4-vaccine strategy meant you have to have enough doses for the whole population, and they didn't. So they should have been looking for other vaccines at that time. It's unknown what happened with Moderna or Johnson. There were other vaccines available, but we did not have a 4-vaccine policy.
Dr. Norman Swan, thanks so much for joining us.
My pleasure, Lisa.
I know it all seems scary right now, particularly when you're seeing it pop up all over the country, but the reality is for the last year and a half we've been saying we're going to have to learn to live with the virus. And that's going to mean lockdowns intermittently until everyone's vaccinated. I know these things tend to take us by surprise and people rightly feel angry when life's being disrupted. But it does also strike me that this is what they've said all along. I remember Norman Swan saying it at the very beginning of this. These things are going to happen, and until the vaccine is whatever, 70, 80% through the community, I think that's what life's going to be like.
But as he said, the frustration is the hotel quarantine. Like 26, I think, at last count, out of hotel quarantine. That is an incredible number.
Yeah.
From expert opinions to in-depth analysis and reporting, the Project YouTube brings you the biggest stories from Australia and around the globe. Hit the subscribe button now for news delivered straight to your feed.